Ladies and gentlemen, to Helius Medical's channel, a leading neurotech company in the medical device field, non-invasively improving lives of people dealing with neurological diseases. Joining us to give us a bit of his background and a high-level overview of his understanding of the value of Helius, we have Dane, the CEO, joining us as always. Welcome back, sir.
Thank you, Kyle. It's good to be back.
Pleasure to get you on. So let's get right into this. I mean, you've been acquiring Helius shares, kind of getting close to 11%. The stock is actually up pretty nicely here. I think we're well over 20% in some gains heading into the holiday seasons. And you have this background as a hedge fund manager. How do you see the value of Helius? And give us an idea of why you're picking up shares.
Yep. My previous 20 years was I started a hedge fund called Maple Leaf Partners. My largest investor was Tiger Management and Julian Robertson, and I was always a deep value investor. Like you said, Kyle, we're trading below cash. Helius right now is just under 6 million, and there's no debt on the balance sheet. It's a very clean balance sheet, and we've got a great management team in our CMO, CFO, and really head of regulatory as well.
Now, how do you kind of see yourselves positioned here for 2024? As you mentioned, your market cap is trading at some decent levels here. But what do you guys look forward to in the future, especially when it comes to this product?
So reimbursement is really critical right now. We're cash pay, and that's one of the negatives right now. Even though PONS therapy for balance and gait deficit in Canada due to a traumatic brain injury, stroke, and MS is how we're authorized and commercializing. But in the US, MS patients were authorized in gait deficit due to MS. And it's really critical to get reimbursement coverage in the United States. Just recently, at the end of November, we met with CMS Medicare in the public meetings for our HCPCS codes and potential economic benefit class. And we'll know something in early February with their decision then for an effective date, April 1st.
Yeah, definitely appreciate the insights. And finally, what are you most focused on here? I know investors have been patiently waiting as we kind of come out of this horrible market environment, and things look to be nominalizing. But in this backdrop of this rather volatile market this year, I mean, what are you most focused on?
Well, right now at Helius, we're focused on our U.S. stroke pathway. We've expanded from a pilot study to 60 subjects at the Medical University of South Carolina. And we're hoping to use our second FDA breakthrough designation towards a regulatory submission in stroke using this trial. We're hoping to expand it further, multiple sites and multiple more patients so that we could get well over 60 for 2024, end of 2024 regulatory submission with the FDA. And with that second breakthrough designation, that allows us an accelerated pathway through the FDA for authorization in a stroke. But the last thing I want to mention also, stroke is 7 times greater the indication versus MS. And that creates a massive opportunity for investors at these valuations.
Well, on that note, I'll pass that question on to the viewers. Let us know what you think in that comment section below. Consider subscribing when further catalysts and news come down the wire. Of course, we'll bring it to you here. But on that note, as always, we'll catch you in the next one.